My dear students, welcome to R.A.T.S, Racing Against Time for Students in Pathology. The enclosure shows it is a class on general pathology and the importance is highlighted here. Many detail can be obtained from this particular picture. I would like you people to decipher your own method of understanding this. The topic here is cell injury, one of the first chapters. And as mentioned earlier, the importance is given here. I always have the habit of clinging on to the university questions because your IQ is equal to UQ. And the question that we omit is our university question. Subheadings. Think of the subheadings. The subheadings will take you to the answer. These were words of wisdom that I gained from my professor of dermatology. These are the various subheadings. These can change according to the topics. A diagram of the cell which you people are pioneers in from your school upwards. A cell is the physical and the functional unit of a living body. And since today's topic is on cell injury, we shall just recapitulate that there is a cell membrane, a cytoplasm, various organelles, the nucleus, nucleolus, and a lysosomal vacuole. So these are certain things which will repeatedly haunt us or rather help us during pathology. And now, what is the difference between what we had seen in the previous slide and this? There is, of course, the nucleus, the organelles, and the cell membrane. But then I could imagine that there is a maze of network that is leading from one to another. The complexity of this function shall be realized over a period of time. This is a very important line diagram, courtesy Robbins. This is a normal cell. The normal cell is constantly being exposed to stress, just like you and me. Sometimes we are able to adapt ourselves to the stress. So also the cell. This is called cellular adaptation. In some cases, you find that the stress is too much or that there is an injuring or an insulting agent. This leads to a cell injury. Also, when the cell is not able to adapt itself beyond a period of time, it can go in for a cell injury. Injury always occurs and there can be a recovery, and it is called a reversible injury. The cell becomes normal as though nothing has happened. Or sometimes when the agent is severe, progressive, persistent, it causes an irreversible cell injury. Irreversible also can be divided into a cell death or necrosis, or sometimes it can be programmed, which is called apoptosis. So for the time being, let us remember that there is a cell injury which can be either reversible or irreversible. And courtesy goes to Robbins. What are the definitions? Definitions are definitions. I request you people, please do not have your own words for definitions. The cell, for example, it is the physical and the functional unit of a living body. Tissue is a group of cells which are similar in structure, function, and origin. The organ, whereas, can be a group of tissues which are carrying out a specific function. And an organ system, such as the digestive system or the hepatobiliary system, can be having a set of functions carried out by each for a purpose. Normally, you find that the milieu interior or the homeostasis is being maintained. There is not much of a change within us. We are not different on Monday and then on Tuesday. We are almost the same. And this is Sir Rudolf Virchow, the father of modern pathology. His name shall come in many an instance, and so also many great personalities, which we shall repeatedly revisit. The topic per se is cell injury. What then causes cell injury? It can be physical, radiation, chemical, hypoxia, infections, immunological, genetic, aging, so on and so forth. So it can be anything. Physical, for example, when there is going to be a crushing trauma. Radiation, people in the radiology department or people who are going to be exposed to a Chernobyl disaster. Chemicals, pouring acid on the skin. Hypoxia, lack of oxygen. Infections, any bacterial, viral or fungal infections. Immunological, hypersensitivity. Genetic, as we are programmed. And aging, obviously with age, there can be some amount of damage to the various cells and tissues. I am giving you just a few examples. Look at this hand over here, the fingers. This is probably a fair-skinned person. This is a normal skin, but then it is becoming more dusky, brown, and the tip of it is developing a black color. This is called a Raynaud's disease, owing to focal or local vaso-occlusion. Occlusion of the blood vessel can lead to this. Continuing with the causes, this I hope you people are able to recognize the glomerulus, the proximal convoluted tubule, descending, and the loop of Henle. Sometimes there is a condition called as ATN, acute tubular necrosis. It can be because of a number of causes which we shall be seeing in systemic pathology. Because of that, these blue colors indicate areas of damage. So this is one form of injury. It can be because of hypoxia, it can be because of a snake bite, it can be because of drugs whatsoever. Okay. Or imagine this, there is a nuclear explosion occurring at the surface of the earth. Normally it is done deep sea down, but here it has been done on the surface. You can imagine what kind of a catastrophe it can be causing to the people nearby as well as to the generations to follow. Again, we shall concentrate on the terms. I mentioned about the normal cell, the homeostasis it is in. So it is subject to change, it will come back to normal. But when the stress is going to be increased or when there is going to be an increased demand from the cell, for example, it needs more oxygen, then it has to adapt. The body will have to adapt itself to the changes. If it is not able to, then it goes in for a cell injury. The cell injury also can be repaired. It can become a normal cell, or it could undergo a cell death. So this particular concept, I would like you people to have it in mind. If you are not convinced, see this. This is a normal liver, beefy red in color, shiny, obviously looking very healthy. Compare it with this. Slightly enlarged, yellowish, capsule is stretched and heavier. Something has gone into the liver. It is a fatty liver. These things we shall be seeing elsewhere. Obviously, it is not normal. It is an alcoholic liver disease. If the patient stops taking alcohol at this stage, it can go back to this normal liver. Yet another example. This is a normal myocyte. Myocyte is a muscle cell. So it is a normal cardiac myocyte, we can say, because I can see the striations. And whenever there is an increased demand, as I had mentioned earlier, patient is anemic, so it has to pump faster. Therefore, it has to become larger and stronger. We call it a hypertrophy. And finally, you find that even the ventricle becomes enlarged. This is a left ventricular hypertrophy. So normal heart is over here. You people can compare. We shall come back to this topic later on. But however big it becomes, it also needs oxygen. Sometimes it also can undergo an injury or even a necrosis, what we call as myocardial infarction. And it undergoes a cell death, which is reflected in the liver as pale areas. So this is a specimen of a myocardial infarction. These things we shall be visiting any number of times. This is a little complex, but shall form the fulcrum of our answer. So, as I mentioned earlier, there is a flow diagram showing the importance of reversible injury. A blood vessel, there is an obstruction, no flow of blood, which is called ischemia. It affects the cell. And what does the cell contain? Many organelles, of which mitochondria is most important. So this is called oxidative phosphorylation. The mitochondria undergoes oxidative phosphorylation, because of which there is a increased production of ATP, adenosine triphosphate. There is a failure of the sodium pump, because of which there can be an inflow of calcium. We call it as influx, water and sodium. The pump has failed, so it is not able to pump it out. Therefore, these materials start coming inside. Whenever the sodium comes inside, potassium goes out. This is called efflux. And these will cause a lot of changes such as these, which will be shown diagrammatically. Cellular swelling, microvilli lost, blips, endoplasmic reticulum swelling, myelin figures, etc. Also, there will be a glycolysis, which can lead to a decrease in the pH and the loss of glycogen, which will be leading to clumping of the chromatin. The other effects shall be detachment of the ribosomes and diminished protein synthesis, lipid deposition. So this is one diagram given in your text, but I would like you to kindly follow and make a note of my own class over here. So far, so good. If the insult has been removed, the cell might revert back to normal. But if it is going to be persistent, then what happens is there is an irreversible cell injury or cell death. So there is a membrane injury which can lead to all these changes. It can happen because of free radicals, etc. And there is a leakage of enzymes which will lead to various enzymes which are produced in infarctions. Also, there will be a release of the lysosomal enzymes from within the cell, which will lead to damage to the nuclear protein. So this particular flow diagram, I would like you people to kindly memorize. As mentioned earlier, this is the fulcrum. There is a thrombus, ischemia, mitochondria undergoes an oxidative phosphorylation, failure of the sodium pump, and influx of calcium, water, and sodium leads to all these cellular changes. The ATP is lost, there is glycolysis, and there is a decrease in the pH and the glycogen. This leads to a lot of activation of the lysosomal enzymes, which can lead to RNA damage, ribonucleoprotein, and then a DNA also. The membrane as such, it can undergo all these changes. We will be seeing what is happening. So in the exam, you will have to write what is reversible injury, what is irreversible injury. Sometimes they can ask you, for example, cytoskeleton alterations are features of reversible injury or irreversible injury? Obviously, the answer is here. So this is an interesting flow diagram, not for us to follow, but to memorize and write. What are the pathogenesis of cell injury? This is the mechanism, this is the effect. Calcium influx leads to mitochondrial damage. Activated phospholysis, there is membrane damage. Intracellular proteases, cytoskeletal damage. Activated endonucleases, nuclear damage. Lysosomal enzyme can lead to entire cell death or phagocytic activity. So this is important. So same thing is again repeated. So there is an injurious stimulus, diminished amount of ATP, there is a damage to the membrane. So there is an affection of the mitochondria which can lead to diminished amount of ATP and multiple downstream effects which can lead to necrosis. Also, there can be cytoskeletal damage, DNA damage. So please remember these four things first. Diminished ATP, membrane damage, cytoskeletal damage, DNA damage. And what are all the changes that can occur because of these? Ultimately, there will be a cell death. It can be either necrosis or apoptosis. Courtesy, Robbins. Look at this one. These are the series of changes you can see in the cell. This is a cell membrane, mitochondria, endoplasmic reticulum with ribosomes, lysosomes, cytoskeleton, actin and myosin filaments, then the nucleus. These are all the structures. What happens to them? Initially, there will be cytoplasmic blebs, and then there will be a swelling of the cell. But later on, there can be a membrane damage or myelin figures in irreversible injury. Initially, swelling of the mitochondria, but then there can be vacuolation. And there can be swelling of the ribosomes and dispersal, later on lysis. Lysosomal sacs can engulf all the damaged particles, or they can become ruptured leading to cell damage. Cytoskeleton also becomes damaged and disrupted. The nucleus, initially there is clumping of the chromatin, but later on there will be the changes called pycnosis, karyorexis, and karyolysis. So this is a little too much, I am too fast. Therefore, I have compiled it in a table for you people to memorize. So these are all the changes. Kindly memorize this particular table. So this again, there is an injury. It is an imaginary one. It can be anything. And look at the changes. So you find sodium, water, etc. come inside it. This is called influx. Potassium goes outside. This is called efflux. This is a very, very important change in a patient suffering from myocardial infarction, etc. The serum potassium level can save a life or take a life. The cytoplasm itself undergoes a swelling, and there can be vacuoles which can be present. And these are all the changes in the nucleus. Karyolysis, it becomes somewhat dissolved. Pycnosis, it becomes shrunken. And karyorexis, it is becoming fragmented. Karyo means chromatin. These are all the various changes in the reversible injury. Repetition is the mother of knowledge. And this particular diagram, I would like you people to kindly draw. Look at this one. There is a cytoplasmic bleb. There is an edema of the entire cell. And there will be the various changes in the organelles. Swelling of the organelles, clumping of the chromatin, and there can be lysosomal activity leading to damage. The same thing is repeated over here. A normal cell, any form of insult, it leads to the various changes that have been mentioned earlier. If the insulting agent is removed, it reverts back to normal. There is a recovery. But if it is going to be persistent, then all the changes that we had mentioned earlier goes in for irreversible change, and we get these. For example, myelin figure, one of the favorite MCQs of mine. You find it is a change in reversible injury, irreversible injury, adaptation, all of the above. So any fool can ask more questions than the wisest man can answer. And if it is going to be persistent, there is an ultimate damage to the cell or tissue, which is called necrosis and cell death. Same thing is mentioned over here. I would like you people to kindly draw this particular diagram. Reversible and irreversible. Reversible first. These are all the reversible changes we had seen earlier. Again, it has been mentioned. Kindly enumerate and go to the tabular column that I have mentioned. But later on, it can become irreversible. That can be because of the change in the mitochondria. There can be an influx of calcium, a smooth endoplasmic reticulum, etc. So ultimately, there is an increase in the cytosolic calcium, which leads to diminish in the ATP. All the enzymes can be activated. Look at this one: phospholipase, protease, endonuclease, ATPase. What will happen when phospholipase is activated? It leads to phospholipid damage, which is there in the membrane. When protease is activated, there is damage to various cellular proteins. When endonuclease is activated, there is damage to the nuclear membrane. ATPase is activated, there is a fall in the ATP. What more do you people want to answer? So these are all the reversible and the irreversible changes. Please explain. I would like you people to kindly identify and name these changes. Nothing is forever except change. Thank you.